Hi, are you Gina?
Yes.
Hi, I'm Amber. I'm a nursing student.
Hi, Amber.
I have your patient in room 231.
Okay.
Is it okay if I get a report on her?
Sure. The patient in room 231 is Miss Shanana O'Connor. She's a 34-year-old African-American female with end-stage renal disease, and she's undergoing hemodialysis. She's been admitted to the medical surgical unit from the ED with a fever of unknown origin. She came in to the ER because she was having complaints of fever, chills, and general malaise. She's oriented to person, place, and time. She does have allergies to trimethoprim and sulfamethazole, which we have down that they cause rash, but we will check with her on that. She's a full code. And for the past few days, the patient reports elevated blood glucose and decreased appetite, plus minimal urine output for the last month. She does have a history of renal failure secondary to diabetic neuropathy and hypertensive nephrosclerosis. She undergoes scheduled dialysis 3 times a week and has for about a year. She was listed for transplant 6 months ago. She has diabetes mellitus type 1 and has since she's 8 years old. She controls that with insulin, but lately her sugars have been more out of control. She was here 3 months ago for a graft infection, and that was resolved after IV antibiotics. The patient has history of recurrent UTI issues and does well with the different antibiotics that we've provided for her previously. Cranial nerves are grossly intact, deep tendon reflexes are intact, sensations diminished in her lower legs, and she's reporting numbness and tingling. So we do have her as a low fall risk for that, so we're keeping her bed at the lowest level and keeping her call light close by. Her chest expansion is symmetric, clear to auscultation. Patient denies shortness of breath or pain. Patient did quit smoking 2 years ago. She is having some tachycardic but does have regular rhythm. S1 and S2 are present. No murmurs or extra heart sounds. She has a slight 1+ non-pitting edema in lower extremities. Femoral pulses are 2+ bilaterally. 1+ pedal pulses in both feet. Cap refills less than 4 seconds. And she's not having any chest pain or palpitations. Recent weight gain of about 10 pounds over the past few weeks that we want to keep an eye on, probably due to not urinating as often. Her abdomen soft, round, and non-tender, no visible masses, and bowel sounds are present in all 4 quadrants. She has been placed on a renal diet with 1,500 milliliters daily fluid restriction. Her urine has recently become more concentrated and darker in color. She's denying pain, burning, and difficulty urinating, and we're able to do a straight cath if she's unable to void. Her oral temp is 100.9, and we're to report that to the physician if it gets above 101. Her blood pressure is 138/78, and we're to report if it gets above 180 over 100. Heart rate is 108. Respirations 20, O2 sats 97 on room air. She's 5'9". She weighs 177 pounds, and her blood glucose this morning at 5:45 was 210. We did just check these vitals about 30 minutes ago. She has a urinalysis, and she has a urine culture that were ordered, and they were taken in the ER, but those are pending. Vital signs every 4 hours or PRN if needed. INOs every shift, and due to the weight gain, we need to do daily AM weights, same clothes, same scale for her. And her A1C was 8.1 when it was checked in the ER. She did have a pain level of 4 that was treated with Tylenol a little while ago, so we'll want to check on her for that. What we're doing now, the doctor's ordered imipenem. It's also Promaxin. It's one of the carbapenem antibiotics, so that's what I'm getting ready to give to her.
All right, thank you. I have a couple questions for you.
Sure.
Why specifically is this client receiving this medication?
This medicine is an anti-infective, and she has a fever of unknown origin, so they're giving her the antibiotic to hopefully relieve the infection and decrease the temperature.
What action does this medication have on the body?
The medication binds to the bacterial cell wall and results in cell death. It destroys the cell walls, which destroys the microorganism.
And when should you question administering this medication?
For this medicine, if a patient has an allergy to penicillin or cephalosporins, or if the patient also has a history of seizures, there's things like if they were taking Depakote for seizures, this antibiotic would decrease the Depakote level, and you would want to keep seizure precautions on that patient.
And does this medication have a therapeutic serum level?
No, it does not.
Which vital signs must be monitored?
Since the patient has a temperature, you want to monitor the temperature for sure. Since it's an antibiotic, you want to monitor all the vital signs really. They include anaphylactic signs such as shortness of breath, trouble swallowing, flushing, redness, and itching.
Which physiological parameters should be monitored when this medication is being administered?
You want to monitor for anaphylaxis signs and symptoms like rash, pruritus, laryngeal edema, wheezing.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
Well, we want to make sure that we're checking the doctor's order. Also, since she's on dialysis, we want to check with the pharmacy to make sure the order is okay for her. We want to keep the call light closed, check the IV site for pain, redness, and itching, and also want to check for symptoms of thrush, which are like white patches in the mouth. Make sure she's brushing her teeth and using oral rinse.
And what interventions must be taught for taking this medication safely at home?
She won't be taking this specific medication at home probably. It's IV, and we would have to set up something special for that. So she will be taking it, taking a medication PO by mouth. So we want to make sure she takes it as prescribed, checks her temperature at home, and does finish all the medication.
And what are the side effects and potential adverse effects?
Diarrhea, nausea, vomiting, rash. We want the phlebitis at the IV site. Things even as seizures, C. diff, anaphylaxis, stomach cramping. There's a lot of different things like that.
And how will you know when the medication is effective?
We want to look for the patient to show some signs of improvement, decreasing temp, no adverse effects of the medication, no pain or inflammation, clear urine, clear lung sounds.
And that's all the questions I have for now.
Okay. Would you like to go in with me?
Sure.
Okay, thank you. Hi, Miss O'Connor, is that correct?
Yes.
Hi, my name is Gina. I'm your nurse for the evening. I have a patient with me, a student level 1 from SPC. Would you mind if she's along with me?
No, that's fine.
Okay, great. And could I see your name band and your allergy band? And your name and age, please?
Shanana O'Connor, 34.
And what are you allergic to?
Trimethoprim and sulfa drugs.
Okay, what do those drugs do for you? Do to
Get a
you?
rash.
You get a rash? Okay, that's what I had reported, but I just wanted to make sure. Okay. Well, I see that you've been having a fever and you haven't been feeling so well lately. Not hungry, or you've been real tired, lethargic. The doctor's ordered a urinalysis and waiting on a urine culture for you, but wants to go ahead and get you started on some IV fluids and an antibiotic to get a head start on clearing up whatever bacteria is going through your system. You do have a right to refuse medication as a patient, but we hope that you would want to take this so we can start getting you better. Is that okay with you?
Mm-hmm.
Okay. I see you already have an IV there.
Mm-hmm.
Sorry, one more time.
It's like an 18 gauge, and you're right median. I'm going to clean that port with alcohol and flush it because we want to make sure that there's no bacteria or anything there. We want to make sure it's sterile. To do that, I am going to clamp that and clean for 15 seconds to make sure that there is a sterile connection.
So the antibiotics in first, so it has to be
Okay, I'm going to flush that. Does that feel okay?
Mm-hmm.
Make sure we unclamp it. Flush. And I'm going to go ahead and leave this right here because that will keep that sterile for us. Okay. Is your IV feeling okay? Is there any redness, swelling, itching?
No.
Okay. Now I'm going to get your normal saline. That is going to help us keep the IV line going, give you some extra fluids. Maybe you'll get some more urine output. They're a little cold, so you may want some extra blankets. You can just let us know.
Okay.
Okay. So again, I need to get your name and your age.
Cheyenne O'Connor, 34.
Okay. I'm going to get out the normal saline. I want to check to make sure that the clarity is good, that it's clear, that there's no holes in the bag, no sediments. I need to check to make sure the medication has not expired, and the expiration date is 10/2017. We want to compare it to the order. Sodium chloride, 0.9%, normal saline, at a rate of 30 milliliters an hour, and we've got 500 milliliters in the bag, but we're only going to set that at 450 so it doesn't dry out. We don't want a dry line going into you. Okay. I'm going to scan medicine. We need to prime the line. Now the spike is very sharp and we want to keep it sterile so we don't touch that. We unplug the bag. It's very sharp and you could puncture the bag, so you have to be careful. Make sure you don't do that.
Okay. So, so we went over,
Okay. Gotta hook it into the Alaris machine. The first thing I need to do
we went over the side effects and everything.
is clamp it,
And call me if your IV starts turning to, okay?
and we're going to label it.
Do you have any questions? No, I don't.
This is a label that will alert us that we need to change the tube 4 days from now. We're going
Okay, so call me
to
if you have any questions.
prime the
okay?
tubing.
Okay.
That just means to run it through.
Bye. Do you mind if I ask just a couple more questions? Sure, that'd be fine.
Were there any pertinent pieces of information you reviewed before administering this client the medication?
Yeah, we reviewed all of her lab work to see that she had an infection, especially
And
her
put this
CNS,
tube in.
which showed
Blue to blue.
Cimetizine, which is that's the drug we chose.
And did this information affect your decision to administer the medication?
Yeah, it really narrowed down which antibiotic would be most effective.
And did this information affect how you administered the medication?
We administered it IV piggyback, make sure we get any more infections, so yeah, I did. Okay, great.
Thank you.
You're welcome.
That's fine primed.
I wasn't planning.
I'm going to clamp that, and now I will take off the flush, and it is still sterile.
Did you, I didn't notice it.
I'll clamp that until we're ready.
The expiration date.
New patient, yes.
But what happened
Med
was
cert, yes.
I was trying to type in the date.
I need to enter your
and
number.
I was trying to type in the
I
time.
have that right here is
And
8,
the
2,
I
4,
couldn't- but I
7, 8,
So
2,
when I went back, I just
3.
I was like skipped it.
Confirm that. The IV guardrails fluids, 0.9% normal saline. Yes, this is correct. The rate, we are going to do 30 milliliters an hour. And we do have a 500 milliliter bag, but we are going to put 450 so it doesn't run dry into you. And hit start. I'm going to unclamp here. Okay, so that is on its way into you. You may, like I said, you may feel a little cool. Let me know, we can get you some blankets. Just want to document quickly. 18 gauge right forearm. IV right. Okay, now I'm going to add the imipenem, which is Pramaxin. Have you ever taken that before, ma'am?
No.
Okay. You're going to want to look for just side effects. Not, you may not get them, but we want to check to see. Sometimes you can have side effects like you do with normal antibiotics, like nausea, vomiting, stomach cramps. If you feel like you're going to have diarrhea, let us know. And I know you're having some trouble with your legs, we'll help you to the restroom. But also there's things, I don't know if you've ever heard of thrush. It's like white patches in your mouth. It's nothing to be scared of, but we just encourage you to brush your teeth and do like some rinses throughout the day, okay? All right. So again, for your antibiotic, I need to, and is it okay? You're not refusing your antibiotic at calls? Okay. Let me check your armband again. I'm sorry I have to keep doing this.
Sarah O'Connor.
Okay. And I'm going to get out piggyback. And to hang a piggyback, we need to bring main one down. We have the same things that we look for. We want to compare. We have the imipenem Pramaxin, 500 milligrams every 8 hours. We're going to do IV piggyback at 8 o'clock today. So I'm going to just scan. There's Clarity. It doesn't expire until 12/2017. And the same with this. We need to make sure that this is sterile. So we will pull that off of there. that in there. And we want to get the closest hub and clean that out for 15 seconds and make sure that's sterile as well. Okay, after 15 seconds, we want to make sure this is clamped, and I'll be putting the sticker on that, same as I did the other. That is clamped. Okay, I'm going to backflow. Open those up. Okay. And your label. Doing okay with the liquid so far?
Mm-hmm.
Hang piggyback, and that'll take over. And then when that completes, then it will switch back. So now we're going to set the secondary. Memopenum, 500 milligrams, 9 milliliters. Yes, it's correct. Confirm our secondary. Number there. Great volume. There we go. All right. So the piggyback has started now. When that stops, then it will kick back over to the saline, okay? And we'll come back in every 8 hours for that. So what are some of those things that I told you may want to look for?
Thrush.
Diarrhea. Oh, good. You even remembered the name, the thrush. Okay. I have a paper here for you about the antibiotic, and I've set the recordings, the videos on the TV so you can watch and see some of the things for that. Now, is there anything that I can get for you right now? Okay. Appreciate your patience, and thank you for letting the patient. Thank you for letting the student come in. Okay, let me put the time in here. Quick comments. Forget what I gave you. Okay. All right. Perfect. Thank you so much. And I will be back to check on you and make sure everything's okay, all right? Remember, I've got your bed down to the lowest position and the call light. If you need anything at all, please let me know, okay?
Okay.
Thank you. Okay,
I just have a couple more questions for you.
sure.
Were there any pertinent pieces of information you reviewed before administering the client the medication?
Yeah, specifically the allergies. We want to make sure that she wasn't allergic to penicillin or the cephalosporins. I did check the order from the doctor, the med, time, route, patient, expiration, color, clarification of the med, patient's vitals, and also we wanted to make sure that we gave it after dialysis so that it's not filtered out.
And did this information affect your decision to administer this medication?
It did, specifically with the dialysis, and you always want to double check your order, make sure you have all of the correct info so you don't make any med errors and put anyone at risk. So yeah, now I do have a few things to document. I need to document how the patient reacted, how, just a few different things that if you would like to hang out, I need to document the teaching, interventions, interaction, and how they tolerated the medicine if you'd like to stick around for a minute, but
I have one more question.
okay.
And did this information affect how you administered the medication?
It did. We just gave the medication as ordered, like we said with the after dialysis, and worked with the pharmacist to make sure that it was going to be okay for her, and made sure she knew about side effects.
All right, thank you very much.
Thank you.